Hello everyone. The topic for this session is submandibular region. The objectives are to learn about the submandibular region, suprahyoid muscles, genioglossus and hyoglossous muscle, sublingual salivary gland, and few questions will be given at the end for the assignment. The submandibular region includes the deeper structures in the area between the mandible and the hyoid bone. It includes the floor of the mouth and the root of the tongue. The contents includes suprahyoid muscles, submandibular salivary gland, sublingual salivary gland and submandibular ganglia. So in this session, I will be discussing about the suprahyoid muscles and the sublingual salivary gland. The submandibular salivary gland and the submandibular ganglia we will discuss in the next session. Suprahyoid muscles. These muscles are present above the hyoid bone. That's why the name suprahyoid. It includes the digastric muscle, stylohyoid, MYLOHYOID and GENIOHYOID. And in this region, the muscles are present in layers. So, there are 4 different layers. The first layer includes the digastric and the stylohyoid. The second layer includes the MYLOHYOID muscle. The third layer includes GENIOHYOID and the HYOGLOSSUS. The fourth layer includes GENIOGLOSSUS. So we will discuss one by one all these muscles under the origin, insertion, the nerve supply and action. The digastric muscle, it is having 2 bellies. That's why the name digastric. The bellies are the anterior belly and the posterior belly. These 2 bellies are interconnected by intermediate tendon. The anterior belly, it originates from the digastric fossa of the mandible. The fibers runs downwards and backwards. It is inserted into the intermediate tendon of digastric, and that tendon is attached to the hyoid bone by the fascial sling. Development. This belly is developed from the first pharyngeal arch. The nerve supply is by MYLOHYOID nerve. The action, it depresses the mandible and elevates the hyoid bone. The posterior belly, it originates from the mastoid notch of the temporal bone. The fibers runs downwards and forwards. It is inserted into the intermediate tendon of the digastric and attached to the hyoid bone by fascial sling and the 2 slips of stylohyoid. Nerve supply is by fascial nerve. So when we observe the 2 bellies, that is anterior and the posterior belly, the nerve supply is different. That is because this posterior belly is developed from the second pharyngeal arch. So the anterior belly is supplied by MYLOHYOID nerve, whereas the posterior belly is supplied by fascial nerve because it is developed from the second pharyngeal arch. The stylohyoid, this is a small muscle, lies on the upper border of the posterior belly of the digastric muscle. It is originated from the posterior surface of the styloid process and inserted into the junction of the body and the greater corner of the hyoid bone. So it is perforated by the posterior belly of the digastric muscle. The development, it is developed from the second pharyngeal arch. Nerve supply is bifacial nerve because the facial nerve is the nerve of the second pharyngeal arch. Action, it assists in the elevation and retraction of the hyoid bone, and also it fixes the hyoid bone with other hyoid muscles. Next muscle is mylohyoid muscle. It is also known as oral diaphragm. It is flat triangular muscle. The two mylohyoid muscles forms the floor of the oral cavity. So it is also known as the oral diaphragm. Its posterior border divides the mandibular salivary gland into large superficial and the small deep part. And also it forms the floor of the submental triangle and part of the floor of the digastric triangle. Origin from the mylohyoid line of the mandible, and insertion, the posterior fibers are inserted into the body of the hyoid bone. The middle and the anterior fibers are attached to the median raphe that is present in between the mandible and the hyoid bone. Development, it is developed from the first pharyngeal arch. Nerve supply is by nerve to mylohyoid. Action, it elevates the floor of the mouth in first stage of deglutition and also helps in depression of the mandible and elevation of the hyoid bone. Next muscle is geniohyoid. It is short and narrow muscle present in the oral cavity. It lies medial to the mylohyoid muscle. Origin, it arises from the inferior pair of genial tubercle. Insertion, it is inserted into the anterior surface of the body of the hyoid bone. Nerve supply, it is supplied by C1 through hypoglossal nerve. Action, it elevates the hyoid bone and depresses the mandible when the hyoid is fixed. Hyoglossus muscle, it is the muscle of the tongue, originated from the whole length of greater cornu and the lateral part of the body of the hyoid bone, and it is inserted into side of the tongue between the styloglossus and the inferior longitudinal muscle of the tongue. It is supplied by hypoglossal nerve and it helps in depression of the tongue and makes the dorsum convex, and it retracts the protruded tongue. Structures related to hyoglossus muscle. Hyoglossus muscle is the key muscles in this region, that is in the submandibular region. So the structures related to the hyoglossal muscle is very important. The superficial relations includes styloglossus, lingual nerve, submandibular ganglion, submandibular gland and the duct, the hypoglossal nerve and the veins accompanying the lingual artery. All these structures forms the anterior relation or the superficial relations. The deep relations includes the glossopharyngeal nerve, the stylohyoid ligament and the second part of the lingual artery. So genioglossus, it is the bulkiest muscle of the tongue and it is fan shaped. It arises from the upper genial tubercle of the mandible. So the genial tubercles, there will be superior genial tubercle and inferior genial tubercle. So we have seen the geniohyoid is arising from the inferior genial tubercle. So whereas genioglossus is arising from the superior or the upper genial tubercle of the mandible. Insertion. The upper fibers are inserted to the tip of the tongue. The middle fibers along the length of the dorsum, and the lower fibers are inserted into the body of the hyoid bone. The nerve supply, it is by hypoglossal nerve. Action, it pulls the posterior part of the tongue and protrudes the tongue, and it is a life-saving muscle. The muscle of safety is the GENIOHYOID. So now we'll learn about the sublingual salivary gland. We all know there are three major salivary glands. Those are the parotid salivary gland, that is the submandibular salivary gland, and the sublingual salivary gland. So it is the smallest of these three salivary glands, and it is almond shaped and weighs about 3 to 4 grams. It lies above the MYLOHYOID and below the mucosa of the mouth. It's having about 15 ducts which emerges from this gland. They open into the floor of the mouth on the summit of the sublingual fold. Few of them join the submandibular duct. Relations of the sublingual gland. Above, it is related to the mucous membrane of the mouth, and below it's related to the MYLOHYOID muscle. In front, it meets the opposite gland, and behind it comes in contact with the deeper part of the submandibular gland. Laterally, it's related to the sublingual fossa, and medially is related to the GENIOHYOID muscle. Blood supply is by lingual artery and the submental artery. And the nerve supply, the secretomotor nerves, they arises from the submandibular ganglion. The parasympathetic secretomotor fibers arises from the superior salivatory nucleus and passes through the facial nerve and then the cauda tympani nerve. So this cauda tympani nerve joins the lingual nerve and enters the submandibular ganglion. So from the submandibular ganglion, the postganglionic parasympathetic fibers supplies the gland through lingual nerve. And the sympathetic supply is through the plexus around the facial artery, and the sensory supply is through the lingual nerve. Development of the sublingual gland. The sublingual gland develops after 7 to 8 weeks on the floor of the stomatium. It develops as epithelial outgrowths from the lateral side of the submandibular duct. The cells of the secretory end pieces attain maturity during the last 2 months of gestation. Clinical anatomy. The sublingual glands have short ducts where the chances of stasis is less. Since it is a smaller duct, so the stasis is very less. That's why the obstructive lesions does not occur in this gland. Cyelogram, that is the contrast radiological procedure to visualize the salivary glands and the salivary ducts. So here you can observe the sublingual gland. Now the questions for assignment. First question, the digastric muscle, origin, insertion, nerve supply and action. The MYLOHYOID muscles, that is also under the heading origin, insertion, nerve supply and action. The HYOGLOSSUS muscle and the structures related to it. And the sublingual salivary gland and its clinical aspects. Thank you.